My name is Heidi Wallace and I'm the clinical director at Hazelden Springbrook in Newberg, Oregon. A new patient's going to arrive on campus and be greeted by one of our staff, typically our admissions coordinator, and they're going to meet with that individual and get them admitted into treatment. And that could be at the residential level of care or the day treatment with boarding level of care or our day treatment only. Individuals that are coming in for residential treatment, that individual will be most likely on our medical services unit first, and after being on medical services unit, be moved down to our residential unit. Once you're medically stable, during while all that's happening, you're going to have other personnel that are coming in. So addiction counselors will come in, we have addiction techs that will be there. Individuals come in and they're being treated by either our addiction counselors, our addiction technicians, our medical services unit 24/7. And so that means there's staff availability, there's accountability around the clock. They're checked in on a regular basis and they're unable to leave campus without the escort of one of our staff members, which is typically a Hazelden driver. So often you'll be greeted by your peers while you're on medical services unit, and they come down, they introduce themselves really just to normalize this experience and say, hey, I'm going to be one of your peers down on the unit. And this could be somebody you could be lifelong friends with in recovery. So the treatment day begins typically with morning meditation. So every morning there's a type of meditation that's offered. Throughout the day, it could change at any given time, but there's lectures throughout the day, there's groups throughout the day. The groups could be topic specific, or they could be small groups with their primary addiction counselor. That's what happens during the primary part of the day. In the morning they have breakfast, so they go to breakfast with their peers. The community they are to eat together. It's really important to create that fellowship, eating together. There's 3 healthy meals provided each day. After that, they have groups throughout the day. And then some people could do their exercise in the morning, but often people do their exercise in the afternoon. We have a beautiful exercise facility where there's a number of different items that they could use for exercise. We have a 12-step walking path. That 12-step walking path it could be a meditative path, but it's also an exercise and running path for some individuals. Day treatment is individuals that move it's a lower level of care, and lower level meaning it doesn't have as much structure. The structure is Monday through Friday, typically 8 in the morning through the afternoon. A typical treatment day is 4 to 5 hours of programming, which equals about 20 hours of programming a week, Monday through Friday. And then the off times, they're having their meals together. Those individuals can leave campus together. There are times where people could be at the day treatment with room and board, and counseling will ask that they not leave campus that evening if there's maybe some risk factors involved. But for the most part, people are able to leave, and they go into the community to go to meetings. In the Portland metro area, they drive themselves. They have their own cars. If they don't have a car, they rent cars because it's a real, true, sober living experience. So it's a completely different experience than the residential. We have a 3-day intensive family program that's offered on a regular basis at the Hazelden Springbrook campus. Our 3-day program starts early in the morning and ends in the afternoon, and throughout the day what the family members are experiencing is a number of different lectures and topics related to the disease of addiction, around shame, around communication, how to communicate, setting boundaries, a lot of different topics, but more importantly, not only are they educated about the disease of addiction and family, but it's really about them. The family program is not about the person their loved one that's struggling. It's more about their process of how do I heal, how do I have my life recovery with this individual who's struggling, and love them and be part of that journey with them, but take care of myself. I would tell a loved one that was trying to get help for their family member to pick up the phone and call our 800 number at Hazelden Betty Ford. There's 24/7 help where they can get the resources that they need.